My name is Maureen Bongren. I'm here today to do a peripheral vascular assessment on you. And what's your name?
Margaret Taylor.
Okay, Miss Taylor, can you give me a birth date?
January 28th, 1996.
Okay, and today I'm going to have to touch your arms and your legs. Is that okay?
Mm-hmm.
All right, I need to ask you some questions about your health today. Do you have you ever noticed any color, temperature changes or texture change with your skin on your arms and your legs? You ever noticed that they've gotten cold or pale looking?
No.
Because if they are, that's associated with arterial insufficiency if they were. Do you experience any pain or cramping in your legs and that goes away when you rest? Like they hurt?
I mean, after a long time, like exercise or standing for long
Oh
periods.
no, just for no.
No.
Okay. Do you experience any pain or cramping in your legs?
No.
Okay. Do you have any wounds or open sores on your arms or legs?
No, not currently.
Okay. Do you have anyone in your family? Do they have a history of diabetes, hypertension, coronary heart disease, leg pain, or high cholesterol?
I believe so.
Okay. I think you told me earlier that you had a grandmother with diabetics.
Yes. Yeah.
And your grandfather with hypertension. Both your grandfathers, actually. Okay. Do you smoke?
No.
Do you take oral contraceptives or a patch contraceptive?
No.
Okay. I'm going to start off your exam by checking out your arms. Okay. I need you to hold your arms out for me. Okay. And what I am checking for right now is to see if they're the same size bilaterally. Okay. And they seem to be symmetric. If one had been larger than the other, then I would take a tape measure and I would measure them. I would mark the spot that I was measuring, like here, and mark it, and then I would measure both of them. But your arms and your hands, all of them seem to be symmetrically the same size, which is good. Okay. I'm going to look and check and see if you have any wounds on your arms. No. Let me see. Okay. Or any, it's called venous patterning, and like if you had any patterns of veins on your arms. I don't see any. Hands, no. Okay. Okay. All right, and your color of your skin is appropriate for your ethnicity. It's this both your arms and your hands are all the same color. There's no discoloration of one or the other, which could signify an arterial insufficiency. If maybe you didn't have sufficient blood flow in one or the other of your extremities, which is good. Okay, I'm going to check your fingernails for clubbing, and clubbing is an angle that is less than 165. So your your fingernails, there's no clubbing present, which is good. Okay. Okay, and also I'm going to check your temperature. Hold both your arms out for me, from your top of your arm down for temperature. Your skin is warm from the top of your hands down to your fingertips, which is good. Okay. Okay. All right, and I'm going to check your capillary refill. Now, normally, ideally, you wouldn't have nail polish on. I do see some of your polish is chipped off, which actually is a good thing for me. But I'm going to check. Hold both your hands out. I'm going to check each of your fingers. And capillary refill should be under 2 seconds. If it was longer than that, it can indicate a problem. But your capillary refill is under 2 seconds for all your fingers, which is good. Okay. If it did not, you could sometimes people if the capillary refill is too long, it could be hypothermia. If your hands are cold, you've been out in the cold, or it could be an indication of shock. Okay. All right. Okay. I'm gonna check your pulses here. The radial pulse here, and check the same bilaterally. Okay, they are. They're nice. They're both 2 plus. It's good. It's radial. I'm gonna check your ulnar. Now this one sometimes is tricky for me. Sometimes I don't always get this one. Okay, and they're the same, which is it's good to check you have them, but it's also good to check they're the same bilaterally. Okay, check your. Okay. Okay. And your brachial pulse. They're nice and they're good. They're the same bilaterally and they're strong, which is good. Okay. It's equal strength bilaterally. Okay. And I'm going to check your epitrochlear lymph nodes. Okay. And you really don't always. They're normally not palpable. Um, if they are enlarged, it could indicate infection. Oh, here it is. And I don't feel any. Okay. That's good. Okay, I'm going to perform something called the Allen test, okay? I'm going to take my thumbs and I'm going to include your radial and ulnar right here, and I'm going to press down and I want you to clench your fist, okay? And now I want you to release it. And I'm going to release your ulnar thing. See how your hand pinked up? That means you have a patent ulnar artery. This is good. Okay? Let me see. Okay. All right. I'm going to check your legs now. Okay. All right. And put your legs here. Okay. Provide for your privacy here. Okay. 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 I'm going to check your legs. I'm going to check the same. The size is the same from top to bottom. Okay. And the color is the same. All right. And I'm going to check the temperatures using the dorsal part of my hand. And from the toes to the thing, check the one side here too. It's warm. Okay. Okay. So I'm going to also check for hair distribution, and you should have hair on your legs, and you should have it on the dorsal part of your feet and your toes, and you do. I'm just checking my own toes, and you do actually have hair on your toes. Not a lot, but you've got even hair distribution on your legs. Which is good. Okay. Okay, I'm going to check your legs for lesions or wounds. Check your feet. A lot of times people who are diabetic can get wounds if they don't have sufficient blood flow to their extremities. They can end up with wounds that don't heal. Okay. Okay. All right, that's good. Okay, no wounds. I'm going to check your legs and your feet for edema and swelling. I don't see any. What we often do is we press down, especially on your feet. Sometimes fluid tends to pool there when people are on their feet, and I know you have a retail job. If you did have edema, there's something called pitting, and when you press down, you would actually leave an indentation in your feet, your ankle, or your legs. But so there is no edema in your legs, or your feet, or your ankles, which is good. Okay? Let me see. So they're the same size bilaterally. The temperature is warm. Okay, and I'm gonna see what else I need to hear for you today. Okay, I'm going to palpate the superficial inguinal lymph nodes here. Okay, I'm going to provide for your privacy here. Okay, I'm going to keep you covered up. And this might be a little ticklish. I know you're ticklish. Okay, okay. Okay. Okay, I don't feel anything. You can sometimes you can get a feel something, 1 to 2 centimeters nodes would be normal, but I don't feel any. Okay. All right. Okay, and I'm going to listen to your femoral artery pulse, your femoral pulses here. I'm going to palpate them and listen to them. Okay. So I don't mean to tickle you here. I'm sorry. Okay. I'm going to palpate them, and this is going to be ticklish as well, I'm sure. Okay. Can I feel the pulse? I can just do this bilaterally. Get tickling over it one time. They're bilaterally. They're strong and equal. Okay, which is what they're supposed to be. Okay, I'm going to listen to them. And since you're so ticklish, I'm going to clean my stethoscope here, and I'm going to warm it up because I know you're ticklish here. I'm going to listen, okay? Okay. And what I want to listen to for is a okay. Okay, I don't hear anything. That's normal. Okay, listen to the other one. I'm sorry. Okay, we use the bell and my diaphragm. Try the bell here and see if I hear anything. No. I'm going to try the bell on this side here. Okay, I'm going to palpate your popliteal and your pulses, okay? This is under your knee here. Okay, they're normal. They're strong. Okay, try the other one. Okay, and they're bilaterally the same, which is good. Okay. Okay, I'm going to do your Thorsalis pedis, and sometimes I just like to go from between your big toe and your second toe, come up and then go laterally to feel these. And sometimes in the elderly, these are really hard to get. I can actually do both of them at the same time, so I can compare them. Okay. Okay, and they're normal. They're strong. About a 2. Okay. And I'm going to check your posterior tibial pulse and see if it's. Let me see if I can do this. Move them at the same time. Okay, okay. And these actually, sometimes I don't get these on people, but these are pretty good, strong. They're even bilaterally, which is good. Okay. Okay, and I'm going to check your legs for varicose veins and thrombophlebitis, which I actually, when I inspected them before, you don't have any varicose veins or thrombophlebitis, though. With retail, you might want to start wearing support hose. Sometimes it helps when you're on your legs a lot, but that is a danger for people who are on their feet a lot, but you don't have any at this point. Okay, I'm going to do something called position change test. Okay, I'm going to take, and this is probably going to tickle you too. Okay, I'm going to take my forearms and lift your ankles and your knees up. I want you to lay back a little more. Yeah, okay. Raise them above your heart level here. Okay. Okay. Now I want you to wiggle your feet, kind of shake your feet a little bit here. Okay. Okay. And this is to drain your venous blood. Okay. Then when I put your feet down, I want you to put your feet on the side of the bed. Okay. Put them down and dangle them off the side of the bed. And I'm going to see how long it takes for the color to come back into your feet. And it came back very, very quickly. On the tops of the feet, if it comes back within like 15 seconds, then that's normal. So, and that's, and yours, that your color, your feet pinked up against that was pretty good. Okay, and there was another test for varicose veins, but since you don't have any, we don't have to do that last test. Okay, thank you so much.
Thank you.